is so right. If we prevent some of the diseases that we end up having because of risks, we will be so much better off. Okay, so let's go right away to the introduction. The head and neck region is made up of integrated components of several body systems, making the assessment of this area complex. The integumentary, musculoskeletal, gastrointestinal, respiratory, cardiovascular, endocrine, and neurological systems are present in this region. So, yeah, it is. The interconnected body systems in the head and neck regions are assessed at the same time. When performing an assessment of the head and neck, it is important to be aware of psychosocial, cultural, and environmental factors that may influence the health of this body area. So, a patient's level of stress, behaviors, and activities influence overall health, and the effects may be apparent in the structure and functioning of the components of the head and neck region. It is also important to consider the influence of the patient's beliefs, values, knowledge, and base related activities of daily living and self care practices. Okay, so I'll tell you where to concentrate. Nothing on these bones of the skin. It is important, and this you can just make a note to canthus, what is the palpebrae fissure, the nasolabial. And again, this belongs to the practicum. Again, for the practicum, know the triangles of the neck, and know the thyroid, but for the practicum. Lymphatics, you need to know this. And numerous lymph nodes are located in the head and neck region of the body. These nodes provide defense against invasion of foreign substances by producing lymphocytes. Lymphocytes are white blood cells and antibodies. The lymph nodes are clustered along lymphatic vessels that infiltrate tissue capillaries and pick up excess fluid called lymph. Know that for purposes of the practicum, you will need to memorize these notes. But for now, you don't have to do that. And this is the location of the notes. Again, that would be for the practicum. These are the vessels of the neck. That is nice to know. This you need to know, the special considerations. All the systems that we see here, they will include these special considerations. Age, as the patient gets older, their hair becomes thinner and graying, and there is a decreased amount of hair. That is true. I noticed it on my own hair. Aging repairs more slowly, sweat glands activity decreases, and nails become thicker and rich. Developmental level changes over time, lymph nodes present at birth, but differentiate and growth lymphatic tissue occurs between ages 4 and 8. Race, all races share 99.9% of same genetic material. Ethnicity pertaining to or a characteristic of people that shares a common distinctive culture, origin, language, and accent. So you can change ethnicity, but you cannot change race. Of course, the work history, the living condition, the socioeconomics, and emotional well-being will impact all of these structures. Healthy People 2020 reduces sports and recreational injuries. This is just nice to know. At the moment, nice to know. Melasma and the pregnant women. Older adult. Loss of subcutaneous fat in the face. This is what will happen as the patient grows older. Decrease in reproductive hormones. hair changes, teeth losses, range of motion limitations, complaints of feeling tired and weak, which may be related to thyroid dysfunction, stress-induced illnesses or illness, tension headaches, neck pain, mouth ulcers, chronic TMJ syndrome. Chronic TMJ syndrome may eventually result in wearing down of the teeth. There is a question on this. TMJ, what is that? I think it's grinding of the teeth that will lead to chronic TMJ. You know, when the person during sleep they kind of grind their teeth, that will lead to chronic TMJ syndrome. And eventually, when the person gets the TMJ syndrome, they wear down their teeth. This is just psychosocial considerations, and that is when the person's other indications of psychosocial disturbances include tics, hair twisting or pulling, and lip biting. That's nice to know. Implications of disorders that alter appearance on the patient lead to self-esteem issues. Referral to a specialist may be needed. Changes in the efficiency of the lymphatic system. That is nice to know. Cultural, eye contact, smiling, or sharing personal information. Religion includes head coverings. Cultural beliefs and practices about modesty may influence patients' behaviors. So this is knowledge in general that you will have about whenever you are conducting a physical assessment. Environmental impacts on the health status of the components of the head and neck include the patient's physical environment and access to food and other nutrients, which is very nothing on FAST, which is fetal alcohol syndrome. Iodine deficiencies. Iodine is an essential trace element. Deficiency, though, can lead to goiter. This is goiter. You see the neck, how thick it is there. So when the person has a deficiency of iodine, they can develop goiter and intellectual disabilities. Foods rich on iodine includes milk, tuna, sea bass, yogurt, and cheeses. Make sure that you know that.
A few slides where you said it's nice to know, it's nice to know. Do you mean that are we going to be assessed on that next week, or that's not necessarily?
Nice to know means you are not going to be tested on that.
Okay.
But it is nice to know.
But it is nice to know. Yes, I agree. Thank you.
Nothing on focus interview. It is nice to know. Techniques, know the techniques for the physical assessment. Head, neck, and related lymphatics. You inspect, palpate, and auscultate only. And the head, we are not going to go into great detail in here because on week 8, we are going to describe how it is done. Hopefully, we might end up going on week 8 to the school, to the skills lab, so we can see how to really done every skill, so everybody's on the same page. We'll talk a little bit more about that later. Okay, so the next pictures just are related to the physical assessment that you will be doing. Like how do you do check the temporal arteries? So it's nice to know for this area. The trachea, the same thing. Thyroid, the same thing. The lymph nodes, the same thing. The only thing that you have to know about the lymph nodes, that whenever you are palpating the lymph nodes, you should not be able to palpate them. If you palpate them, that is an indication of infection. So lymph nodes are non-palpable. Oops, sorry, I forgot to unplug this. Okay. Already, so again, palpating the lymph nodes, You don't need to memorize them now, but you will have to whenever you are doing your physical assessment. But you need to know that you normal findings are non-palpated. You do not palpate it.
Professor, I'm confused. You just said never palpate the lymph nodes?
No, you should not. You should not be able to palpate the lymph nodes. So, in other words, you palpate the lymph nodes, but you should not feel them. That is, when you feel a lymph node, you feel a node. You feel like a little bulge there. That is not normal.
So, okay, but the slide says palpate the lymph nodes.
Yeah, you need to palpate them, which means you need to touch them, because that is the name of them, lymph nodes. But the findings, and that is a normal finding.
So palpate the lymph nodes and expect not to feel them.
Exactly.
Okay.
Palpate means just touching them. That's what it means. Nothing on headaches. Nothing. No Bell's palsy. That is the slide 49. Versus CVA or cerebral vascular accident. Nothing on Cushing's, nothing on Down syndrome, nothing on FAS, nothing on hydrocephalus. Parkinson's disease. It will be in the final, but not now. Nothing on torticollis, nothing on hypothyroidism. Yes. There is no hyperthyroidism, because hypothyroidism is the exact opposite of hyperthyroidism. So if you know one of them, you will know the correct answer. You understand what I'm trying to say? So no hypothyroidism. If you know one of them, you will know that is not hyperthyroidism, or vice versa, because their symptoms are complete opposite. Like one can tolerate the cold and one cannot tolerate the heat. And so if you know one, you will know the opposite. So for this overview of selected thyroid disorders, you just need to know nothing. That's it. So see, we finished with 4 minutes to spare. How about that?
So I'm sorry, real quick. Can we go back to the